We are going to discuss now the drug metabolism, the various aspects of drug metabolism in this chapter. For simplicity and understanding, I am dividing this chapter in the 3 to 4 parts. So the current part deal with the general introduction to drug metabolism and the phase 1 processes of drug metabolism, majorly the oxidation processes of the drug metabolism. So just quickly revise. Drug metabolism, as we all know, is the process after the absorption and the distribution of the drug. The major site for the metabolism is the liver. In this process, the commonly drugs are inactivated, but in some cases, a drug after metabolism give you a metabolite which is more active. For example, terfenadine. Terfenadine undergoes the metabolism to give you fexofenadine as a more active metabolite. In some cases, metabolite also lead to toxic metabolite generation. For example, cyclophosphamide, where cyclophosphamide will give you acrolein as a toxic metabolite. But in general, we can say drug metabolism leads to inactivation of drug. There are some other exceptions to this also. Another important concept is a prodrug. The prodrugs are those drugs where drug itself is inactive, but it undergoes the metabolism and gives the active moiety. For example, Prontosil, which is a prodrug, it undergoes metabolism and it gives you sulfanilamide as an active moiety. Now, what is the difference in this prodrug and a earlier case of one drug active and the metabolite is also active? In the earlier case, the drug itself is active, like terfenadine is active and the fexofenadine is active. That means the parent drug is also active and the metabolite is also active. But in the case of prodrug, parent is inactive and the product, that is the metabolite product, is active. So this is the main difference between the prodrug and the others. Now, generally, drug metabolism is divided into 2 parts: phase 1 and phase 2. In the phase 1, lipophilic or non-polar drugs are converted into the relatively polar metabolites. And the phase 2. In the case of phase 2, phase 1 metabolites are converted to highly polar metabolites ready for excretion. So what happens in phase 1? Our non-polar or lipophilic drugs are converted to the water-soluble compounds. Now these relatively more water-soluble compounds will act as a substrate for phase 2 enzymes. Phase 2 enzyme cannot operate instead and unless phase 1 metabolite is there. So for phase 1, substrate is a drug, and for phase 2, substrate is phase 1 metabolite of the drug. So in phase 1, relatively polar substances or relatively polar metabolite is formed. In the case of phase 2, that relatively polar metabolite is converted to highly polar metabolite, which is then sent for an excretion to kidney. So the major enzyme in the case of phase 1 metabolism is the cytochrome P450 enzyme. Now this is the list of the enzymes which are considered to be a phase 1 drug metabolizing enzymes. As I already said, cytochrome P450 is a major contributor in the phase 1. Then FMO, that is flavine monooxygenase, is also one of the phase 1 enzyme. Then MAO, monoamino oxidase, is also another contributor in the phase 1 enzyme. And this monoamino oxidase has a very common role in a metabolism of the primary amino containing drugs and the neurotransmitters. Like if our drug contains primary amino as a functional group, then it will the best target for the monoamino oxidase rather than cytochrome P450. Or in the case of neurotransmitters like norepinephrine, dopamine, serotonin, they have a primary amino group. So all these neurotransmitters containing primary amino group will undergo the metabolism preferentially by the monoamino oxidase, but not by the cytochrome P450. Another phase 1 enzyme is xanthine oxidase, then alcohol dehydrogenase, aldehyde dehydrogenase, and the peroxidase. For alcohol dehydrogenase, substrates contain alcohol. Aldehyde dehydrogenase substrates contain aldehyde, and the peroxidase, for peroxidase, definitely the substrates contain peroxide moiety. Now this is a list of phase 2 drug metabolizing enzyme. The major contributor in this case is UDPGT, which is nothing but a UDP glucuronide transferase. It's a name of an enzyme. The process it carries out is a glucuronidation process through UDPGA is a cofactor or a coenzyme, we can say. UDPGA is UDP glucuronic acid. So UDPGA is a cofactor. Glucuronidation is a process carried out by UDP glucuronide transferase. Another important enzyme in the phase 2 is N-acetyl transferase. Enzyme name is N-acetyl transferase, and reaction it carried out is acetylation. Third is sulfation. The reaction carries out is a sulfotransferase and the cofactor is 3-phosphoadenosine 5-phosphosulfate, abbreviated as PAPS. Methylation is carried out by methyl transferase and the substrate is S-adenosyl methionine. Glutathione conjugation is carried out by glutathione S transferase as a enzyme and the glutathione is a cofactor. Glycine conjugation and the COMT are the other contributors to phase 2. COMT is nothing but catechol O methyl transferase. So this is a list of phase 2 enzymes which are involved in the drug metabolism process. So now just simply understand what do you mean by cytochrome P450. Rather, cytochrome P450 is a super family of an enzyme, hepatic enzymes responsible mainly for the phase 1 drug metabolism interactions. So now this super family of an enzyme requires heme as a cofactor. The function of the cytochrome P450 is a monooxygenation. Structurally, the cytochrome P450 contain porphyrin ring and NADPH or FAD as a cofactor. Now when solutions of a cytochrome P450 that is liver microsomal solution containing cytochrome P450 when purged with a carbon monoxide, and if you take an absorbance of this solution will get absorbed at a lambda max of 450 nanometer, and therefore this family of an enzyme got the name as cytochrome P450. So now how this cytochrome P450s are named, or how the nomenclature of cytochrome P450 in general is, it is a very brief introduction to the nomenclature of CYP family. Like for example, as mentioned here, CYP1A2. So now here CYP450 or CYP stands for superfamily. 1 indicates the family having the 44% sequence homology. What do you mean by that? When I say CYP1, CYP2, CYP3, CYP4, that means all the members of CYP1, CYP2 and CYP3, CYP4 and so on have the 44% sequence homology, and 55% they are difference in their gene sequences, and because of this they become a member. They become a member of either they will go in CYP1 and becoming the depending upon their differentiation they become a member of 2 or 3 subfamily. Next is a A. Now this what A is. This A indicates a subfamily. Now again I will introduce what do you mean by that, or again I will explain what is that. When I say CYP1A, CYP1B, CYP1C, now all those who are in a CYP1 or who are in a family of a CYP1 are included in the CYP1 category or included in the CYP1 class because they have a 44% sequence homology. But as already mentioned, they have difference in the gene sequences also. So this difference in the gene sequence make them a member of A, B or a C. So all those who are having the 55% sequence homology will go in CYP1A. All those who are different in 45% different, have a 45% difference in the sequence, they will go to CYP1B and CYP1C and so on. Next is a 2. So CYP1A2. What is this 2? 2 indicates the gene which is responsible for coding that CYP1A. So now in general there are 17 isoforms of the CYP gene have been observed in human beings. Like if you have 1A2, 1A3, 2A6, 2D6, 2C1 etc. Now they are differentiated or they become a member into 1A2, 1A3, 2A6 and 2D6 depending upon the 90 to 95% sequence homology. Now again what do you mean by this? CYP1A2 and CYP1A2 and CYP1A3, meaning those who are having 90 to 95% of sequence homology will go to CYP1A2, but those who are different will go to CYP1A3. So likewise, simply we can say the cytochrome P450 family has been nomenclated into CYP1A2, CYP2D6, CYP3A1 and CYP3A2. So just begin with the phase 1 reactions now. The phase 1 reactions mainly are of 3 types: oxidation, reduction and hydrolysis. Out of this, oxidation is carried out by cytochrome P450, reduction is carried out by various reductases like nitroreductases, azoreductases and so on. Hydrolysis is carried out by esterase. Now oxidation, so just begin with the oxidation or the oxidative biotransformation. Now this process converts less polar drug or less polar moiety to more polar moiety. Now this oxidation is further divided into the aromatic ring oxidation, side chain oxidation and so on. So what to remember in this case is we have to remember, or we have to more concentrate on the site where the metabolism going to take place. Now aromatic ring is a site, side chain is a site, allylic carbon is a site, benzylic carbon is a site. What do you mean by that? Our drugs have the many functional group. Like you can see here, the diazepam itself contains the aromatic rings. There are 2 benzene rings. One benzene ring is free, whereas another benzene ring is fused with a azepine or a 7-membered nitrogen containing ring. Then you have an amino group here, you have a ketone group here, and you have various double bonds here. So now one drug can undergo many types of a phase 1 reactions, and depending upon the site of the metabolism. So it is not that a diazepam have only the metabolites which are shown in this particular slide. Diazepam, depending upon their sites, can undergo various types of reactions and can form various metabolites. So it depend upon the site of the metabolism. So what do you mean by that? In chemistry, in organic chemistry, whenever I say bromination of alkane, meaning what you understand by this term, bromine is added on the double bond of alkene. So for addition of bromine, in this case alkene double bond is a site. When I say electrophilic nitration reaction, in that case nitration to occur, benzene ring is a site. Esterification, to occur in esterification, a site is alcoholic hydroxy group and the carboxylic acid. So depending upon, likewise, or on a similar basis, we can say aromatic ring oxidation, side chain oxidation, benzylic carbon oxidation are the sites. Means if in our drug we have a various functional groups, preferentially where the metabolism is going to occur is decided by this functional group. So if my drug contains aromatic ring, preferentially excluding all others, aromatic ring will get first undergoes oxidation. It is like that. So you have to concentrate more upon the aromatic ring. You have to concentrate more upon the sites of the metabolism instead of by hearting the examples which are mentioned in this particular lecture or in this particular slide. It is not that we ask you or we give you only these examples that are covered. Examples can be anything. Like for aromatic ring oxidation, I can even give you only benzene. You have to just understand that it contains aromatic ring, so therefore the metabolite will be phenol. Or if I give naphthalene, the metabolite will be alpha naphthol, because it is aromatic ring oxidation. So likewise, remember the site. Don't remember the exam. Don't by heart the example. Example can be anything which can be from your syllabus or it can be apart from your syllabus. So identify the site from the given structure and accordingly you write the metabolite structure. So first is aromatic ring oxidation. Now aromatic ring oxidation is the major route for metabolism to occur for a phenyl containing rings. And once you have a hydroxylated metabolite, that hydroxylated metabolite in the phase 2 will enter into glucuronidation or it enters into sulfation. Now diazepam as shown here will undergo the aromatic ring oxidation and it will give you hydroxylated metabolite. Now in the next example, there are two rings. One ring is containing chlorine and another ring is containing benzene. Now there are two aromatic rings, so which will undergo the oxidation. In such cases where you have two benzene rings and one ring is activated and other ring is deactivated, like the ring in this example, the ring where chlorine is attached is deactivated ring. So such a deactivated ring will never undergo oxidation, but the activated ring will undergo the oxidation. So see how enzyme is very specific. It selectively take the ring which is activated, and that activated ring will only undergo the aromatic ring oxidation, and again the oxidation is occurring at a para position. Please remember this. So in the case of aromatic ring oxidation, all the metabolites you will see at the para position of the aromatic ring. So in the case, if you given a choice to the enzyme, if my drug contains one ring which is activated and the other ring which is deactivated, what you have to, or what will undergo the oxidation? Preferentially the aromatic ring which contains activated ring will undergo the oxidation as shown in this diagram, where the ring which does not contain chlorine or the ring which is activated ring will undergo oxidation at its para position to form the corresponding metabolite. So this is how the aromatic ring oxidation takes place. Next is the oxidation of olefins. Now see the example of this drug carbamazepine, where there are two benzene rings and the central ring is azepine ring containing nitrogen. Now you wonder why it is undergoing the oxidation at olefin side but not at the aromatic ring. So this is this. So in this case, the preference or preferentially the metabolite will get at the double bond or the olefinic bond of the carbamazepine, excluding the aromatic rings of the excluding the two benzene rings of the carbamazepine. So this is a preference order, like whenever I have the two benzene ring and I have the one double bond as seen in the carbamazepine, preferentially my cytochrome P450 will oxidize at the double bond of the ring but not at the aromatic rings. So it will exclude the aromatic rings and first metabolite you will get at the double bond or at a olefinic bond. So carbamazepine will form an epoxide and oxygens are added on the double bond of a central ring of carbamazepine and epoxide will be formed and epoxide will be further converted into the diol. Another is a third example of the phase 1 reaction is a side chain oxidation. Now example shown here is ibuprofen. Ibuprofen will form two metabolites. The one metabolite which is by omega carbon oxidation, that is you can see that isobutyl side chain here. In that isobutyl side chain, the junctional carbon is called as omega -1 carbon and the carbon next to the junctional carbon is called as omega carbon. So that omega carbon preferentially undergoes the oxidation. So it is a side chain oxidation to form a CH2H and the other minor metabolite will be formed is omega -1 oxidation which is occurring at a junctional carbon. So next example in the oxidation reaction is the oxidation of benzylic carbon. Now in this case, we can see the benzene ring, or in the example of a tolbutamide, benzene ring contains CH3. So this CH3 which is directly attached to tolbutamide, directly attached to benzene ring will undergo the oxidation. So preferentially, whenever in any given example, you have to first find out what are the different sites where the metabolism can take place. So for example, if your drug contains two benzene rings, where one benzene ring is containing CH3 and the other benzene ring is like that only, it is having no substitution. In that case, you have to preferentially oxidize the CH3 containing benzene ring because CH3 should be directly attached to benzene ring. Please remember the CH3 in this case should be directly attached to benzene ring. So as occurring in a tolbutamide, the benzylic carbon or the CH3 of a toluene ring of the tolbutamide will undergo the oxidation to form a hydroxylated metabolite or alcohol metabolite, CH2OH containing metabolite, which will further give you carboxylic acid as a metabolite. So please remember, if any drug given to you or asked to you contains toluene moiety, CH3 group of a toluene, then you have to oxidize that first, excluding all the others. It is generally observed that in such cases where benzylic carbon is oxidized to form a carboxylic acid metabolite, those particular drugs have the lesser duration of action because CH3 of the benzylic carbon is a very good substrate to undergo the oxidation. So whenever any drug which contains the methyl group attached to benzene ring, it first undergoes or quickly undergoes oxidation to form a COH metabolite, and this decreases the duration of action of the drug. So tolbutamide, because of its quick metabolism, is rather a drug having a very short duration of action. So it is very commonly observed that all the drugs contain methyl group, so they will undergo the COH as a metabolite, and definitely the duration of action of such drugs is we will see the oxidation of allylic carbon. Allylic means CH2 CH double bond CH2, that means propyl carbon or propionyl carbon oxidation. So example of quinidine, where quinidine contains quinuphlidine nucleus, the ring which is at the top, which contains CH double bond CH2. So in such cases, this allylic carbon preferentially get oxidized. So again in this case, quinidine contains quinoline ring and a quinuphlidine ring. So quinoline ring can also undergo the aromatic ring oxidation, but preference order wise, allylic carbon of the quinuphlidine ring first gets oxidized and the second metabolite is due to the aromatic ring of quinoline. So again I am telling it is a preference order, like where if you have the allylic group in your compound, the allylic group will undergo the oxidation very first during the phase 1 metabolism. Next example is the oxidation of a carbon, which is alpha to carbonyl and imine. Again you can see here the example of a diazepam. Now in this case, a diazepam contains a carbon which is next to the carbonyl carbon, and also the same carbon is next to imine carbon. Numbering wise, it is a third carbon. So whenever in your structure or in a given drug you contain such kind of the carbons which are alpha to carbonyl as well as which are alpha to imine, then that carbon undergoes the oxidation preferentially. So here diazepam will also give you this type of metabolite, where the third carbon of a diazepam will undergo the hydroxylation to give the hydroxylated metabolite. Then you have oxidation of alicyclic carbon. Now alicyclic means a closed chain of carbon atom. So here you have a minoxidil. For say minoxidil contains 6-membered carbon chain containing nitrogen, so it is a piperidine ring. So here the alicyclic or similar to alicyclic or a closed chain is a piperidine ring, which is a 6-membered ring. Now that 6-membered alicyclic ring will undergo oxidation very first. So preferentially alicyclic chain of alicyclic part of any given compound will undergo the oxidation very first. And again here it is very specific. The alicyclic carbons undergo the oxidation at the 4th position. So minoxidil contains that piperidine ring. That piperidine will form a metabolite, or piperidine ring will undergo the metabolite to form the hydroxylated metabolite, where the hydroxy group is substituted at the 4th position. Remember, in this case again the enzyme is very selective. It will oxidize the para position or the 4th position of the alicyclic carbon. So here we have completed the oxidation or phase 1 oxidations of the carbons, meaning the carbon which are a part of alicyclic ring, carbons which are a part of benzene ring, carbons which are directly attached to benzene ring. In the next lecture we will see the other types of phase 1 oxidation.